Colleagues, imagine the following situation. You are reviewing a patient's radiograph and notice nothing particularly suspicious. Then you analyze the same image using artificial intelligence, and the system highlights an early carious lesion that you did not detect. Would you trust the algorithm or your own eyes? More importantly, have we reached the point where artificial intelligence can detect dental caries better than a dentist? This question is becoming increasingly relevant following a systematic review and meta-analysis published in the Journal of Evidence-Based Dental Practice, in which researchers evaluated the performance of different artificial intelligence platforms for dental caries detection. Abbott LP, Hoikia A, Anthanapa RP. Artificial Intelligence Platforms in Dental Caries Detection, a Systematic Review and Meta-Analysis. Journal of Evidence-Based Dental Practice, 2025. The authors initially identified more than 2,500 publications, of which 45 studies met the criteria for qualitative analysis. 33 studies used dental radiographs while 12 analyzed clinical photographs. What is particularly interesting is that the review did not evaluate just one algorithm. Across the included studies, as many as 21 different artificial intelligence platforms were used. This immediately highlights an important point. When we say that AI detects caries, we are actually referring to a wide range of different systems whose diagnostic performance may vary dramatically. AI has become an extremely broad term. And this brings us to one of the most striking findings. The reported accuracy of individual systems ranged from only about 41.5% to as high as 98%. In other words, simply saying that we use AI is not enough. The critical questions are: which AI system are we using? What data was it trained on? And what type of images are we asking it to analyze? When the researchers selected studies suitable for quantitative meta-analysis, they found a pooled sensitivity of approximately 76% and a pooled specificity of approximately 91%. A high value for one diagnostic performance measure does not automatically mean that an algorithm is ready to replace the dentist. There was substantial heterogeneity among the included studies, meaning that the results were not equally consistent across all investigations. An even more interesting part of the study concerns the comparison of different caries detection methods. Within the analyzed dataset, artificial intelligence applied to clinical photographs demonstrated higher sensitivity and comparable specificity for caries detection compared with bite-wing radiography. This finding deserves attention, but it should not be misinterpreted as evidence that AI-assisted clinical photography can simply replace radiographic examination. Differences in study design, algorithms, datasets, imaging protocols, and diagnostic reference standards make such a conclusion difficult to justify. And this brings us to perhaps the most important message for clinicians. The question may no longer be whether artificial intelligence will enter the dental practice. It already has. The real question is what role we are going to give it. AI could become a second pair of eyes. An algorithm does not become fatigued after the 10th patient, does not lose concentration toward the end of the working day, and can systematically analyze every region of an image. At the same time, however, an algorithm does not clinically examine the patient. It does not know the complete medical and dental history. It does not independently assess the patient's individual caries risk, nor does it make a clinical decision within the full context of that patient. If an AI system identifies a radiolucent lesion, the dentist still has to determine what that finding actually represents and whether it requires any intervention at all. This is particularly important when dealing with early carious lesions. A false positive result could lead to unnecessary treatment, while a false negative result could result in a missed diagnosis. Therefore, this study does not provide sufficient evidence to claim that artificial intelligence is generally better than dentists at detecting caries. What it demonstrates is perhaps even more important. Some AI systems are already achieving very high diagnostic performance, but their results vary considerably, and we still do not have a universally reliable system capable of independently assuming responsibility for caries diagnosis. Perhaps, then, the future is not AI versus the dentist. A far more realistic scenario may be a dentist with AI versus a dentist without AI. If an algorithm can draw your attention to a lesion that you might otherwise have overlooked, while you use your clinical expertise to determine whether that finding is genuine and clinically relevant, then artificial intelligence is not replacing the dentist. It is potentially enhancing the dentist's diagnostic capabilities. And after reading this study, I would leave my colleagues with one question. If, one day, a rigorously validated AI system becomes a reliable second pair of eyes during every dental examination, will we still view it as a competitor, or will it become as routine a clinical tool as digital radiography and the intraoral camera are today?